So welcome back to Dr. Isaac's Dentistry. We're here with Dr. Isaacs, and today we thought we'd cover something that's a big myth out there, and one of those procedures that we do here in the office that people just find a little scary, even though it's actually a pretty straightforward procedure that we do, and we do them daily. And they're not as big and bad as the stories out there about them are. For those of you wondering what that procedure is, it's a root canal. We call them RCTs, but root canals. And they serve multiple purposes, preserving teeth and fighting bacteria and infection. And they've got this bad reputation as being this horrible event that you have to go to the dentist for. So we brought in Dr. Isaacs today to try to dispel a lot of the myths and give you a little more information on why we do them and what would precede us having to do one for you, and kind of walk you through it so you're a little more comfortable if you're on the receiving end of one of those root canals. So Doc, why don't you let us know what are the big signs or symptoms that we would need to do one for?
Yes. Well, first, let me say that the most fear that we have in patients is probably a fear of a root canal. Number one, they just don't know what it is, and they hear it on the sitcoms and all the comics, all the comedians that make jokes about it, and heck, we do too sometimes, because it's part of our, it's in our culture here that they're terrible, and they're really not. What I tell people, what a root canals aren't bad. It's what happens to let you have a root canal. The toothache is what hurts. So you come in with a toothache, that hurts. We give you an injection. We give you lidocaine. We give you a local anesthetic. That gets rid of the pain. Now you're out of pain. Now we can actually work on that toothache, open it up, drain it, get rid of the infection, and get rid of the nerve endings in there that are causing the pain. And then after the anesthetic wears off, you're pain-free. But it's that thought that the toothache is that the root canal causes the toothache, but they're really not. The analogy I give, it's sort of like having a broken leg, and you go to the ER, and the doctor says you need to have surgery, your leg's broken, and you say, oh no, I don't want a broken leg. They hurt. Well, yeah, that's what you have. You have a broken leg, and the surgery and setting the leg is going to fix it. So that's what it is. So it's really a misnomer to think that the root canal is hurt.
All right, and so what are the indicators that would lead you to decide that a root canal is necessary for a patient? What brings us to the point where it's not just get the cavity or the decay out of the tooth, we have to go further into the root canal?
Several things. Number one, if you come in with a toothache, if you have a toothache of long duration, and we define long duration really more than an hour. If you have something that hurts more than an hour, the studies say 5 minutes, but I give it an hour, just because it might have a little prodrome to it. It may not start hurting for a while. It may be a little nag. So I say if it's been bothering you for an hour, and if you have to take medicine to alleviate it, that's another reason. The third reason would be if you wake up with a toothache. If in the middle of the night you wake up and your tooth hurts, that's a unsolicited pain, and that would necessitate a root canal. Now, why else would you need a root canal? Well, if we see it on the x-ray, you may not even know it, and we may not either, but if we see infection on the root canal, we'll see what's called a radiolucency at the tip of the apex of a root, and that would mean that you need a root canal. And it may not hurt, and it may be there for a while, maybe years, but we know it's not going to go away, so that would mean you need one. Another reason, you come in and we just do a regular filling on you. Do a filling on you, and we get down there so close to the nerve that some of these little tentacles that come out from the nerve endings will get exposed, and then you'll need a root canal, maybe that day, maybe a month from now, maybe a year from now, but at some point you probably will. So that's called a pulp cap.
Okay, and so basically the whole idea of a root canal is to get you, the patient, out of pain, and to keep that pain from returning, and also to fight infection. So I know we've actually got a root canal pulled up here on the screen.
Yeah.
And it sounds kind of, you say open up the tooth, and, we're talking in big terms here. And when we talk about opening up the tooth, we're talking about making basically like doing a filling, drilling out part of the tooth, not a huge hole in the tooth, but we put a small hole into the tooth. And then what we're looking at here, Doc, right, is we've got our nerve endings here. Is that correct?
Right. This patient came in, and it was a very important tooth for this patient because it's an abutment for a bridge, and you can see over time this has leaked underneath of the bridge. It has gotten into the nerve of the tooth and caused a toothache. So she comes in with a toothache, and we numb her up. And I come through the top of it and come into the pulp chamber, which is right here. This is where the nerve vessels and the blood supply to the tooth are inside of it. And I take an instrument and go all the way to the tip of it. We want to get all the way down into here, which is about 20-some millimeters down in here. You've got one big one in the back, two in the front on this particular tooth. This is a mandibular molar, a lower molar. So that's what we did initially. And then, if we'll turn this back up, if I can make this work. If we go to this is the same day. The same day we came in, and I took an instrument and went all the way down there as far as I could, and I got a little snag here we're about almost 2 millimeters away from the tip of the root. We'd like to get right to about a half a millimeter away from it. So that tells me I've got a little bit of work to do. So then we come to the front 2 canals. This particular tooth has 2 in the front. And we come down here and look, I can only get about maybe 14 or 15 millimeters down, so we keep tunneling down in here. And I can't really see that figure, but it looks like it's about 5 or 6. Okay, it's several millimeters down, so that tells us we've got to keep on tunneling down. The red tells me I've got to keep on coming. So then, and that takes about 45 minutes or so. We'll kind of go through a series of instruments, and we'll and use a little bit of medication. We use a chelating agent to soften the inside of the tooth. And keep in mind, folks, the patient is numb. They don't feel anything. If we do, we can drop a little anesthetic right inside there and work it. So it's rare that we have to stop for more Novocaine, but it does happen. If it happens, we just drop it down in there. So.
And what I like to tell everybody is that toothache, it's like Doc was explaining, the toothache that brought you in here hurts way more than anything that we're doing to fix that. Other than the length of time it takes to do a root canal, it's no different than getting a filling. What you would feel getting a filling in our office is about what you would feel during a root canal.
It's about the same thing. It just takes a little bit longer, but we give you breaks because each time I put the chelating agent in, we let it sit about 10 minutes. So we kind of give you breaks. Now this is the finished product. This is after if you remember, I could only go about 2 millimeters short of the apex on this one. So it continued going down. We kept on going a little bit further and got it right down into there. You can see this little bitty curve at the end, which the material that we're using now, it's a gutta percha filling. We use what's called thermofill, which is it's a plasticized gutta percha that we can actually heat up, and after it gets soft, we can place it in there and it will expand a little bit. When it expands, it will actually push out the end of that, and that's exactly what we like to see. And when we do that, the patient might feel just a little twinge, and that just tells us we have a good seal. Now, if you remember on the other two canals, I was up in here somewhere, and I tried like heck to keep on tunneling down, but sometimes they get blocked, and you can kind of see a little bit of cementum, which is right there, that's kind of got it blocked. So we just go as far down as we can. We seal it off because won't let us get any further, and then we do the same thing on these two. And if you can see here, this had what's called an accessory canal that came out the side and actually sealed it right here. So this material is really phenomenal. When I was learning how to do this 30 years ago, no one you could imagine ever doing that. But now these materials are just getting better, so we can actually fill an accessory canal.
Yeah, and I kind of liken this material that the doctor uses to fill those canals. If you've ever done any work around the house, it's kind of like great stuff, but for a dental purpose. You stick it in and it just expands and fills those canals and keeps any bacteria from coming from the bone up into the tooth and causing a problem. And then once we put the filling on the top, it's also going to keep that bacteria from coming from your mouth down through those canals into the bone. In layman's terms, if correct me if I'm wrong, if I oversimplify this, but the whole idea of the root canal, like Doc was showing, he went in here and he cleared everything out. The idea is to clean those nerves out, get all the nerve fiber out of those canals, which is causing the pain for the patient. And then once we know we've got them good and clean and that affected nerve out of there, we put this filler material in there to fill those canals, seal them up, keeping the pain at bay.
Yeah.
Is that
Exactly. And you say, why didn't we just pull the tooth? Well, it was very important to this person. It was a bridge which they've had for a few years, and it's expensive to get it replaced. These bridges they can cost $2,000 to put a bridge in there. And then if you take it out and you go to put an implant, that's several $1,000s too. So with a root canal, we can save you many bucks on that. So that's why we do it. And it's the best treatment around. So this patient will keep this bridge. I've seen her since then, and she's doing fine, no problem at all. And that's kind of what it is and why we do it.
Can we go back to that other photo real quick? Now, sometimes we'll see patients in the office that have a massive amount of infection down here at the bottom of the tooth. So sometimes the root canal will be done in a two-step process in two different visits. We'll bring them in, we'll take the x-ray, we'll see the massive infection here at the bottom of the tooth, and the doctor will do what's called a pulpotomy. It's the first step toward getting you out of pain. So we'll bring you in, doc will drill like he's doing a filling, and he'll use these instruments you see here to go in and start to remove those nerve fibers and the affected nerve that's infected. And then he'll put you on a medication, he'll put you on an antibiotic, and we'll have you go away for a few days to get that antibiotic in your system and working to kill that infection. And then we bring you back in and we'll do what we say here in the office, finish the root canal. So we'll bring you in and we'll start by doing this with a pulpotomy, getting the pulp of that nerve out of there, and then we'll bring them back in a couple of days to finish it once they've had a chance that antibiotic to work on the infection. Is that correct?
Yes, we almost always do a pulpotomy first. The only time we won't do a pulpotomy first is trauma, like if a kid had a bicycle wreck and hit the front tooth. That way we know there's no bacteria there. There's some bacteria, but it's not infected. It's not in the bloodstream yet. So we can forego the pulpotomy and go ahead and do the root canal right then and there. But it's usually 90% of the time or plus we'll do a pulpotomy first, and that kind of gets you out of pain. It lets us know that we can actually do the root canal here. If we can't, we'll send you to a specialist, which we do also. And what does a specialist do? Well, they'll use a microscope, and those little canals that I can't see and I can't feel, they can see them using a microscope and on screen, and they can tunnel down there and extirpate the nerve that way. So.
Right, and that's why that pulpotomy is so important, is that's the first step to getting the patient out of pain. And I know we say it a lot here in the office. You know, somebody will come in and say, I've got this going on and I've got this going on, but as soon as they say, but this one's hurting, our response is always, well, we want to get you out of pain first. So we're going to fix the pain, and then we can fix the other stuff going on.
We always want to get you out of pain, and we always do. And everybody that works here knows that if you're in pain, we'll get you out of pain that day. We're not going to put you off, and if you do, let me know. We'll take care of that. But we always want to get you out of pain first.
Right. Yeah. Pain's our first priority, and then we can go in and we can fix the other stuff later. It's what do you say? I think I hear 4 or 5 times a day. Let's put the fire out, and then we can deal with the smoke later.
That's right. Yeah. A lot of people. Yeah. They're worried about their house is burning, and they're worried about their front door. A lot of times they're worried about that. But you have to get the fire out first, and then we'll start worried about it.
All right. So we've gone over the pulpotomy and the root canal and reasons for it. Are there any complications that can arise post-root canal?
Certainly, with any procedure, there can be complications. It could reinfect. It could crack. That's why we always recommend a crown afterwards. Sometime within the first year, we'd like to get a crown on it. If you have a back tooth, a molar, they're more important to crown than the front teeth, just because of the amount of force you put on it. So I used to wait until they would break, and then we'd crown them. You can't do that. You really need to think about doing a crown. And we'll tell you about what kind of crown you need and the estimated cost of that if we have to do that. But we don't want to get into that. We've talked about insurance and all that before, but we'll do that some other time.
Yeah, and I think that's the most important part, is when we get you here and we're talking, as soon as we start a discussion about having to do a root canal, you're going to hear one of us in the office, probably multiple. You'll probably hear myself or Mary Beth say it first, and then Doc's going to come in and reiterate, okay, now that we're doing this, we need to discuss getting you back for a crown. You know, we went through the procedure to get you out of pain and protect that tooth. Now let's protect it long term with that cap or crown.
We never do a root canal unless we think we can put a crown on it later. You can always do a root canal on the roots, but it won't do you any good unless you can get a crown on it. So we're always thinking putting a cap on it, putting a crown on it. So we don't, and a lot of times we don't. People say, can you save the tooth? Yeah, but not long term, so we don't do it. So we'll take the tooth out. We had to do that this morning, so we did a root canal this morning. We thought we were going to do another root canal, but it was too far gone. We had to get that one out, so it does happen daily.
Yeah, and I think that's a fair thing for those of you watching this to understand is the reason for a root canal is to try and to do whatever we can in the office to save that tooth. Your only alternative to a root canal really is an extraction, losing the tooth. Is that correct?
Yep, without a doubt. Yeah, and if you say I don't want a root canal, I can't afford it, or it doesn't hurt, you're going to need it sometime. We understand. Well, we put things off all the time. We want to get you out of pain and make sure you're not an infection is not coursing through your body. So that's what we want to make sure.
Right, and we want everybody also to understand that our preference, or most of the time, our preference is going to be root canal. We want you to keep your teeth. Just like we want to keep our teeth. Here in the office, our goal is to keep you smiling, keep you with a full set of teeth. Start there, and then if things progress and get worse, that's we'll take that route if we have to. But we always want to keep people smiling and chewing in good spirits.
But we understand we take out a lot more teeth than we do root canal, so we understand. Well, and sometimes it's not worth it. Sometimes you got other things going on. So you want to look at the total picture. Not just you're not worried about just that. You're worried about this person as a human and what they've got to do. If they got a lot of stuff on their plate, we don't mess with you. So that's important to keep in mind, I believe.
Yeah, and I think that's one of the things that is great about the practice here at Dr. Isaacs is we don't try to push anything. It's a conversation. It's truly a conversation between us here at the office and you, the patient, to find out what's best for you. What are you looking for? What works for you? And coming to a solution all the way around that is medically prudent, but then also satisfies the needs of our patients, and making sure we go that way. Now, we did touch on the complications from a root canal, possible reinfection, possible cracking the tooth. Just real quick to wrap up, percentage-wise, would you say you see a high percentage, a low percentage of these complications? I mean, I haven't seen many of them yet, but you've been doing this for 30 years or better. So,
and statistically, it's about 93% successful. But you only hear about the 7% that fails. Everybody knows that their sister had a root canal that failed and didn't. But it's really only 7%. And I've never really done the figures here, but I'm sure we fall right in that because as you say, you've been here since 7 months now, and I don't know how many we've had fail. None. Okay. I mean, so it's and I've done hundreds, maybe 100. I guess we do about one a day or so. Okay.
All right, so we're going to wrap it up here. Hopefully this takes a little mystery out of the root canal and the fears and the fables going around that they're terrible and they're the worst things in the world. It really isn't. It's just like coming in and getting a filling, except for it takes a little more time than an actual filling appointment would take. So hopefully you've learned a little bit. Hopefully we've educated you. Remember, those extended toothaches, anything over an hour, if it wakes you up, all of a sudden you've got a toothache, you want to get into the office here, have us take a look at it and see if we can't get you out of pain and take care of what's going on for you. So until next time, thanks for coming into the office here at Dr. Isaacs Dentistry, and we'll see you next time.